My guest this time is Grace Marie Turner. She is president of the Galen Institute, one of the most respected healthcare policy organizations in the country. She joins us often to talk about health policy issues. And Grace Marie was very active in an effort earlier this summer and throughout the summer to make another push in this Congress for repealing Obamacare, specifically with a push to give the states much more power to determine exactly what system would work best for them. So she joins us now to give us an update and what it all means heading into the midterm elections. And Grace Marie, thanks so much for being with us.
Oh, it's a pleasure, Greg.
Well, obviously, this is something you believe the Republicans needed to get back onto the legislative calendar because they've promised this for the last 4 election cycles ever since Obamacare was passed. They tried to do it last year. It didn't happen, at least not in the Senate, which means it didn't happen at all, really. And so you were kind of bringing back the Graham Cassidy approach of bringing the power back to the states. What kind of response did you ultimately get from Capitol Hill?
Actually, there is a great deal of interest, and we have many people from Capitol Hill not only working with us, but advising us and cheering us on. They're so frightened, though, Greg, of bringing up health care again after the failed vote in July of last year when John McCain, by one vote, really killed the repeal and replace effort. They're afraid of bringing it up again and failing. With Jon Kyl today being named to fill the seat that vacated in John McCain's death, there very well may be another chance to bring this forward. And one of the reasons that I think that could happen, Greg, is that members are getting hammered on the campaign trail because they haven't done anything to give people relief from the high costs and the limited choices of Obamacare. I had a member of the state Senate in Virginia tell us about an email he'd gotten from a constituent who said, I make a pretty good living. I make more than $100,000 a year trying to support my family. And he said, I just got a health insurance bill for $4,000 a month. He says it's more than my mortgage payment. There's no way that I can make that payment and still take care of my family, but I have to take care of my family to make sure we have health insurance. And that's the only policy available to him in the individual market in where he lives in Fredericksburg, Virginia. And he closes his message to Senator Bryce Reeves, what am I supposed to do? That's what they're hearing on the campaign trail. People who are trying to do the right thing, and the costs just go up and up and up. The only people who can afford coverage are those who are getting heavy subsidies. And as a result, the markets are really imploding. The pools are not stable. They know they have to do something, and we have a really good idea. It's a much, much improved version of Graham Cassidy, basically saying one of the things we've learned is that the federal government just cannot manage anything as complex and diverse as health insurance markets in the 50 states. We need to give them not only more power, but new resources to begin to give people more choices of more affordable coverage.
So you think they're going to be punished more for not trying than for trying and failing?
Well, they keep trying to change the conversation to say, let's talk about the economy, and people are saying that's fine, but my health insurance costs are eating up my raises and my tax cuts. They want relief from Obamacare's high costs, especially people in the individual and small group market. People with employer insurance are not as affected. People on Medicaid, people on Medicare, but about 20 million people in the individual and small group market are the people who really are suffering, and they need Congress to act. That's one of the reasons that I think that this will continue to be on the schedule, and thank heavens the Health Policy Consensus Group has spent many months really hammering out what we believe are good recommendations. It's being turned into legislation, and I think still could come up this fall. It really depends on what happens on the campaign trail.
What are you hearing? I know you talked to a lot of different Republican senators because obviously you're pretty much going to need to get all of them on board, or at least only lose one now that the McCain seat has been filled. So do you believe you've been able to kind of figure out a way to get 50 plus one on board here?
Well, it's threading 50 plus 1 needles, right?
Yes.
Everybody has something they want to do. There are probably 46, 47 senators who really understand the importance of passing repeal and replace legislation, and there are another handful who really want something very specific. And so that's one of the things that we're doing. We're working to make sure that Senator Collins and Senator Murkowski have the protections they need for their state, that Senator Rand Paul, he's very interested in health savings accounts, can talk to his constituents about improvements he's made there. Senator Lee and Senator Cruz from Texas, Senator Lee from Utah, Senator Cruz from Texas, very interested in giving people regulatory relief. That's a heavier lift because of the process through which it has to pass the Senate that doesn't allow much room for addressing regulations. But frankly, the Obama administration has been doing a lot to give people regulatory relief. So hopefully we'll be able
Trump?
to... Did I say Obama? Oh,
yes.
My goodness, the Trump administration has... Well, that's an interesting slip because the Obama administration made so many regulatory changes, but at least the Trump administration is making regulatory changes that are legal rather than just kind of trying to rewrite the legislation. So things like short-term limited duration plans, giving people the ability to buy policies across state lines with association health plans, and I think more regulatory relief is coming from the Trump administration.
What's been the role of the media in this? You just talked about how pools are collapsing, premiums are skyrocketing. We never see that in the headlines.
I know it, and it's because I really do think that the media, they've all moved on. Now they want to talk about Medicare for all, single-payer, government-run health care. There's an implicit acknowledgement that Obamacare has failed. People are either trying to blame the Republicans for everything that's happening that's bad, even though they're trying to do everything they can to give people relief, and then they're trying to say, well, we're just moving on from Obamacare. It didn't really work for us to try to put the individual and small group markets under government control. But maybe if we just get the whole healthcare system under government control, then we can make it work. We're going to see how that sells. I don't think so, but that's really what's happened is the media sort of moved on to talk about a bigger government-controlled healthcare system with Medicare for all.
Grace Marie, we'll keep watching. Thank you so much, as always, for your time today. We greatly appreciate it.
Thanks, Greg. Pleasure.
Grace Marie Turner, president of the Galen Institute. I'm Greg Corombos reporting for Radio America.